At 2:29 p.m. on the 13th of April 2020, a tornado touched down in Horry County, South Carolina, near the community of Aynor. It was a Monday afternoon. The National Weather Service in Wilmington, North Carolina had issued a tornado warning for the area at 2:19 p.m., 10 minutes earlier. That warning was based on radar signatures showing a strong rotation within a severe thunderstorm moving east-northeast at roughly 40 miles per hour. The storm had already produced a weaker tornado rated E-phone earlier that morning near the town of Lakeview. Now the same supercell was reorganizing over the PD region. The environment was favorable, high instability, strong wind shear, and a moist low-level jet. What happened next would cut a path 14 miles long through the heart of Horry County. At 2:29 p.m., the first damage was noted just west of the intersection of Highway 319 and Highway 410 north of Aynor. Trees were snapped, outbuildings were destroyed. The tornado was on the ground. It moved east-northeast at approximately 35 miles per hour. At 2:31 p.m., it crossed Highway 501, a major artery connecting Conway to Myrtle Beach. Vehicles were tossed off the road. One driver later reported that the sky turned green, then black, and the wind lifted his pickup truck several feet before dropping it on its side. He survived with cuts and bruises. Others were not so fortunate. At 2:34 p.m., the tornado entered the town of Conway, the county seat of Horry County. Conway had a population of about 24,000 people. The tornado struck a residential area near the intersection of Highway 905 and Highway 378. This is a region of older homes, mobile homes, and some newer subdivisions. The tornado was at its strongest here. The National Weather Service later estimated peak winds of 140 miles per hour, making it an EF3 on the enhanced Fujita scale. It was a high-end EF3 just below the threshold for EF4. The damage was severe. Entire roofs were removed from well-built houses, exterior walls collapsed, and mobile homes were completely destroyed. One mobile home park on Highway 905 was hit directly. At 2:36 p.m., a 66-year-old woman was inside her mobile home on Highway 905. The tornado warning was active. She had received the alert on her phone. She may have tried to take shelter, but the mobile home offered little protection. The tornado struck. The mobile home was lifted off its foundation, rolled, and disintegrated. The woman was thrown into a nearby field. She died at the scene. She was the only fatality of this tornado, but the first of several in the larger outbreak across the southeast. 15 other people were injured, some critically. At 2:38 p.m., the tornado crossed the Whack-A-Mole River, causing significant damage to boat docks and riverside structures. It then moved through the historic downtown Conway area. The downtown district, with its brick buildings and antique shops, sustained damage to several structures. A church steeple was toppled. Windows were blown out. But no one was killed in the downtown area, largely because many businesses were closed due to the COVID-19 pandemic. The stay-at-home orders that had been in place since March meant fewer people were on the streets. The pandemic, in an ironic twist, may have reduced the casualty count, but it also complicated the response. At 2:41 p.m., the tornado reached the eastern edge of Conway, passing near the Horry County Memorial Library and the Conway Medical Center. The hospital activated its emergency plan, but the power flickered and a backup generator kicked in. No patients were injured. The tornado continued east-northeast, now weakening slightly but still dangerous. At 2:45 p.m., it struck a subdivision called Willow Creek, damaging several homes and overturning a recreational vehicle. At 2:50 p.m., it crossed the Intracoastal Waterway near the community of Bucksport. The final damage was recorded at 3 p.m., 3 miles east of Conway near the town of Longs. The tornado lifted. The storm would go on to produce another tornado in North Carolina later that evening. What happened? The Conway tornado was part of a larger outbreak on April 12 and 13, 2010. The same weather system produced tornadoes in Mississippi, Alabama, Georgia, South Carolina, and North Carolina. In total, over 40 tornadoes were confirmed. The outbreak killed at least 9 people. The Conway tornado was the deadliest single tornado of that outbreak. But the question that investigators asked was not just about the weather. It was about the warning system, the vulnerability of mobile homes, and the role of the pandemic in both mitigation and response. The meteorological setup was textbook for a severe weather outbreak in the southeast during spring. A strong upper-level trough moved eastward across the Mississippi Valley. At the surface, a warm front lifted northward, bringing warm, moist air from the Gulf of Mexico. Ahead of a cold front, thunderstorms developed. The wind shear profile was favorable for supercells, strong speed shear and directional shear. The result was rotating thunderstorms. The storm that produced the Conway tornado was a classic supercell with a well-defined hook echo on radar. The National Weather Service in Wilmington issued a tornado warning at 2:19 p.m., 10 minutes before the tornado touched down. That warning was based on radar-indicated rotation. A tornado emergency was later issued for downtown Conway at 2:35 p.m., a rare and urgent statement. The warning was effective in the sense that it reached many people. But it did not prevent the fatality. The woman who died was in a mobile home. Mobile homes are notoriously vulnerable to tornadoes. Even an EF2 tornado can destroy a mobile home. An EF3 tornado is almost always lethal to anyone inside a manufactured home without a safe room. The building codes for mobile homes in South Carolina require tie-downs and anchors, but they do not provide significant structural resistance against winds over 100 miles per hour. The woman's mobile home had been anchored, but the force of the tornado lifted the entire structure off its foundation. She had no basement and no safe room. The nearest community shelter was over a mile away. She was alone. The COVID-19 pandemic added another layer of complexity. By April 2020, South Carolina was under a stay-at-home order. Schools were closed. Non-essential businesses were shuttered. The Conway tornado struck at a time when many residents were already at home. That likely meant more people were in their houses when the tornado hit, rather than in vehicles or public buildings. On one hand, that reduced the number of people exposed in vulnerable places like shopping malls or schools. On the other hand, it meant that families were concentrated in their homes, many of which were not built to withstand tornadoes. The pandemic also complicated sheltering. Public shelters were open only with social distancing measures. Some residents may have hesitated to leave their homes and go to a shelter due to fear of COVID-19. The tornado warning systems relied on phones, weather radios, and outdoor sirens. But sirens in Conway were not tested regularly, and many residents later said they did not hear them. The phone alerts were received, but they often came with a warning tone that was easy to ignore. What investigators found after the tornado was a pattern of destruction that told a clear story. The National Weather Service conducted a damage survey on April 14th. They used drone footage, ground surveys, and radar data to map the tornado's path. The width was 300 yards at its widest. The path length was 14.1 miles. The peak winds of 140 miles per hour placed it at the upper end of EF3. The damage was consistent with a strong tornado. Well-built houses had roofs torn off and exterior walls collapsed. Mobile homes were thrown or rolled. Vehicles were moved. Trees were debarked and snapped. The EF scale is based on damage indicators, not direct wind measurements, so the estimate of 140 miles per hour came from the degree of structural failure. Some engineering analysis later suggested that winds may have been slightly higher, but the rating held. The human consequences were immediate and lasting. The family of the deceased woman received support from local nonprofits, but the grief was profound. The injured included a man who had been in his car when the tornado struck. He suffered a broken pelvis and spent weeks in the hospital. A family in the Willow Creek subdivision lost their home but survived by huddling in an interior bathroom. They had no warning other than the phone alert. The sound was described as a freight train, the classic tornado cliché that is nonetheless accurate. The aftermath brought a community response that was complicated by the pandemic. Volunteers wore masks. Donations were dropped off without contact. The Red Cross set up a shelter at a local church but limited capacity. The recovery was slow. Why does this event still matter? Because the Conway tornado highlights a recurring failure in American tornado safety. The warning system works well for detecting and forecasting tornadoes. Lead times have increased significantly over the past few decades. The average warning lead time is now around 14 minutes, but that warning is useless if people do not have a safe place to go. The majority of tornado fatalities in the United States occur in mobile homes. Studies have shown that mobile home residents are over 10 times more likely to die in a tornado than people in permanent homes. Despite this, building codes for manufactured homes have not been strengthened enough to protect against tornado-force winds. Federal programs exist to fund safe rooms, but they are underutilized and often require matching funds that low-income residents cannot afford. The woman who died in Conway likely had no option for a safe room. Her death was preventable in a technical sense, but not in a practical one given the existing infrastructure. The pandemic context also matters. The tornado hit during a public health emergency that overwhelmed local resources. The same emergency management teams that responded to the tornado were also managing COVID-19 cases. The same hospitals that treated the injured were also treating COVID-19 patients. The Conway Medical Center had to balance trauma care with infection control. The tornado response was not the only crisis. That dual burden is a lesson for future disasters. A community can be struck by two emergencies at once, and the systems in place must be flexible enough to handle both. The Conway tornado was not unique in this regard. In 2020, multiple tornadoes hit during the pandemic, including the Easter outbreak in the South. The lessons were documented by the National Oceanic and Atmospheric Administration and by emergency management agencies. But the changes have been slow. The systems that failed in Conway were not the radar or the warning technology. They were the systems of housing policy, public education, and community preparedness. The tornado itself was a natural event, but the death was a social one. The question that remains is how to reduce the vulnerability of the most exposed populations. The Conway tornado did not prompt a major policy change. The building codes for mobile homes remain inadequate. Funding for safe rooms remains limited. The pandemic emergency response protocols have been updated, but the next disaster may again catch communities off guard. The story of the Conway tornado is not just about April 13, 2020. It is about a pattern that repeats across the United States, especially in the South, where mobile homes are common and tornadoes are frequent. The science of prediction has advanced. Science of protection has not kept pace. The science of prediction has advanced. The science of protection has not kept pace. That gap is not new, but the Conway tornado made it visible in a particular way. In the weeks after the storm, the National Weather Service office in Wilmington issued a service assessment. They found that the tornado warning had been issued with 9 minutes of lead time before the tornado entered the most densely populated part of Conway. That is a respectable warning time. The phone alerts went out. The sirens were activated, yet one person died and many others were injured. The assessment asked a straightforward question: why did the warning not translate into protective action? The answer was not simple. Some residents did not receive the alert because their phones were on silent or because the wireless emergency alert system does not always reach every device. Others heard the siren but did not know what it meant. In Horry County, outdoor sirens are tested on the first Monday of each month, but the test had been canceled in March 2020 due to the pandemic. Many residents had not heard a siren in weeks. When the real siren sounded, they assumed it was a test. The Conway tornado also exposed a problem with the National Weather Service's warning system during dual emergencies. On April 13, 2020, the same NWS office that issued the tornado warning was also handling severe thunderstorm warnings, flash flood watches, and a special weather statement about COVID-19's impact on outdoor activities. The workload was high. But the more critical issue was public perception. The pandemic had changed daily life. People were distracted, anxious, and tired of alerts. Some residents reported that they ignored the tornado warning because they thought it was another COVID-19 emergency notification. That confusion is a documented phenomenon. In a crisis, the saturation of warnings can lead to warning fatigue. When every alert is urgent, none of them are urgent. The response from emergency management was rapid, but it was also strained. Horry County Emergency Management activated its Emergency Operations Center at 2:45 p.m. shortly after the tornado lifted. The initial priority was search and rescue. Fire departments from Conway, Aynor, and surrounding areas responded. The Conway Police Department set up roadblocks to keep sightseers away from damaged areas. Duke Energy reported over 9,000 power outages. Crews began restoring power that evening, but some residents were without electricity for days. The Red Cross opened a shelter at the Conway Recreation Center, but capacity was limited to 50 people due to social distancing requirements. The shelter had to screen everyone for COVID-19 symptoms. Masks were required. The logistics were unprecedented. The shelter manager later said that the hardest part was not the tornado damage but the constant fear of an outbreak. The recovery was slow and uneven. Insurance adjusters were overwhelmed. Many homeowners had policies that did not cover flood damage, and some had no tornado coverage because their policies excluded wind damage in certain categories. The state of South Carolina declared a state of emergency on April 14th, which made federal assistance available. But the Federal Emergency Management Agency was already stretched thin by the pandemic response. FEMA had deployed resources for COVID-19 testing sites and medical supplies. The tornado recovery was handled by the same personnel. The process of applying for individual assistance was complicated by social distancing. FEMA set up a virtual application center, but many elderly residents did not have internet access or were unable to navigate the online system. The disaster recovery centers that normally open in a school gymnasium or community center were not established for weeks. The long-term recovery was led by local nonprofits, including the United Way of Horry County and the Coastal Community Foundation. They raised funds for the family of the deceased woman and for families who lost their homes. But the pandemic limited their ability to hold fundraising events. The typical disaster fundraising model relies on in-person events, dinners, and races. Those were not possible in April 2020. The donations came in online, but they were slower. Some families had to wait months before they could rebuild. One family in the Willow Creek subdivision, the same family that survived by huddling in an interior bathroom, did not return to their home until August because of contractor delays. The contractor shortage was worsened by the pandemic. Many workers were sick, quarantined, or unwilling to travel. The Conway tornado also highlighted the vulnerability of manufactured home communities. The woman who died lived in a mobile home park called Conway Mobile Home Park, located near Highway 378. The park had about 50 homes. After the tornado, the park was largely destroyed. The owners of the park did not rebuild. Instead, they sold the land to a developer who planned to build a storage facility. That is a common story in the aftermath of disasters. Mobile home parks are often located on cheap land, and after a tornado, the expense of rebuilding is not justified. The residents who lost their homes had to find new housing, but affordable housing in Horry County was already scarce. The pandemic had driven up rental prices. Some families moved in with relatives, others left the area. The social fabric of that community was permanently torn. The Conway tornado was one of 77 tornadoes that occurred in the United States during the week of April 12th to April 18th, 2020. That week included the Easter Sunday outbreak, which produced over 100 tornadoes across the southeast. That outbreak killed 32 people and caused over $1 billion in damage. The Conway tornado was part of that larger pattern, but it was not the deadliest. Yet it became a case study because of the pandemic context. Researchers at the University of South Carolina published a paper in 2021 that examined the intersection of natural disasters and COVID-19. They used the Conway tornado as an example of how a community can be double hit. They found that the pandemic reduced the effectiveness of traditional disaster response protocols. They recommended that emergency managers develop contingency plans for multiple simultaneous emergencies. The question of how this could have been avoided leads back to the same structural issues. Mobile homes are not safe in tornadoes, and the building codes have not been updated to reflect that reality. The International Code Council's standard for manufactured homes, known as HUD code, requires homes to withstand winds of 70 miles per hour in most of the country and 100 miles per hour in hurricane-prone regions. That is not enough for a tornado. The HUD code has been criticized for decades. After the 2011 Joplin tornado, which killed over 150 people, many of them in mobile homes, there were calls for reform. Nothing significant changed. After the 2020 Easter outbreak, those calls returned. The Federal Alliance for Safe Homes recommended that all manufactured homes in tornado-prone areas be built to the same standards as site-built homes. That recommendation has not been adopted. The manufactured home industry has pushed back, citing cost increases and stating that the current standards are adequate when combined with safe rooms. But safe rooms are voluntary and expensive. A typical safe room costs between $3,000 and $6,000. That is a significant expense for a family living in a mobile home, often because they cannot afford a permanent house. Economics of vulnerability are clear. The people most likely to die in a tornado are the people who can least afford protection. The Conway tornado also raised questions about warning dissemination. The wireless emergency alert system sends a loud tone and a vibration to compatible phones, but the system has limitations. The alert is geo-targeted to a specific area, but the target area is often larger than the actual warning polygon, causing alerts to go to people who are not in. That creates false alarms. Over time, people begin to ignore the alerts. In Conway, the alert was sent to all phones in Horry County, which is over 1,000 square miles. Many residents received the alert but did not see the tornado because they were miles away. That desensitizes the population. The NWS is aware of this problem and has been working to improve polygon accuracy, but the issue persists. Another problem is that the WEA system does not support embedded media, such as radar images or maps. The alert is text-only, limited to 90 characters. That text can convey the basics, but not the specific threat. Some residents in Conway said they did not understand the severity of the warning because the text just said tornado warning without additional context. The outdoor sirens in Conway also had limitations. The sirens are designed to be heard by people who are outside. Inside a home, especially with air conditioning running and windows closed, the siren may not be audible. In Conway, many residents reported that they did not hear the siren. The siren system was installed in the 1990s and had not been upgraded. After the tornado, the city of Conway allocated funds to replace the sirens with a new system that includes voice capabilities. The new system was installed in 2020, but that upgrade was a response to a specific failure. The wider problem of siren audibility in modern homes remains. The human story of the Conway tornado is not just about the fatality, it is about the survivors who rebuilt their lives during a pandemic. One survivor, a woman named Brenda, lived in the Willow Creek subdivision. Her home was damaged but not destroyed. She had been alone when the tornado hit. She hid in a closet. When she came out, the roof of her house was gone. She had no electricity for 3 weeks. She stayed with her daughter, but her daughter's house was also damaged. They lived in a cramped apartment for a month. She said in an interview that the hardest part was not the physical destruction but the isolation. The pandemic meant she could not go to church for comfort. She could not gather with friends. She could not even attend the funeral of the woman who died. The funeral was limited to 10 people due to COVID-19 restrictions. The community grief was processed alone. Another survivor, a man named James, was a truck driver. He was delivering furniture from Conway to Myrtle Beach when the tornado hit. He saw the funnel cloud from the highway. He pulled over and took shelter in a ditch. His truck was flipped onto its side. He suffered a broken collarbone. He was treated at Conway Medical Center, which was already full of COVID-19 patients. He said the hospital staff were exhausted. He was discharged after 2 days and had to quarantine because of possible COVID-19 exposure. He could not return to work for 3 months. His story illustrates the cascading effects of a tornado during a pandemic. The injury was treated, but the economic impact was amplified by the health emergency. The Conway tornado also affected the local economy. The tornado damaged several businesses in downtown Conway, including a historic building that housed a restaurant and a law office. The building was deemed unsafe and had to be demolished. The loss of that building hurt the downtown revitalization efforts that had been underway for years. The city had been trying to attract tourists and new businesses. The tornado set that progress back by several years. The recovery of downtown Conway was further delayed by the pandemic. Fewer people visited the area. Some businesses never reopened. The state of South Carolina allocated $10 million in disaster relief, but that money was spread across multiple counties. Horry County received about $3 million. The funds were used for debris removal, temporary housing, and mental health services. The mental health aspect was significant. After the tornado, the South Carolina Department of Mental Health deployed crisis counselors to Conway. They provided telehealth counseling because of the pandemic. Many survivors reported symptoms of post-traumatic stress disorder. The sound of thunder, even months later, would trigger panic attacks. The counselors noted that the pandemic added an extra layer of trauma. People were already anxious about getting sick. The tornado added a new fear. The combination led to a higher than usual demand for mental health services. The Conway tornado also prompted a review of the state's building codes. South Carolina does not have a statewide building code for residential structures. Counties and cities adopt their own codes. Horry County had adopted the 2018 International Residential Code, which requires roof tie-downs and impact-resistant windows in certain hurricane-prone areas. Those codes help some homes survive the tornado, but mobile homes are regulated by a separate federal code. The state task force that reviewed the Conway tornado recommended that the state legislature require all new manufactured homes to be built to the same wind-resistant standards as site-built homes. That recommendation was introduced as a bill in the South Carolina General Assembly in 2020. It did not pass. The manufactured home industry lobby argued that the requirement would increase the cost of a mobile home by up to $15,000, which would price out low-income families. The bill was referred to committee and has not been heard since. The story of the Conway tornado is still unfinished. The woman who died is remembered by her family. The injured have healed or are still healing. The homes that were destroyed have been rebuilt or replaced. The community has moved on, but the underlying vulnerabilities remain. The next tornado that hits a mobile home park in South Carolina will likely result in another death. The next pandemic that overlaps with a natural disaster will again test the limits of emergency management. The Conway tornado was a warning. It was not a rare event. It was a predictable consequence of a system that tolerates preventable loss. The question is not whether it will happen again. The question is whether the next community will be better prepared. By mid-April 2020, the narrative around tornado safety had already shifted. The National Weather Service released a statement acknowledging that the pandemic made the traditional shelter-in-place guidance difficult. They recommended that people heed warnings and go to their designated shelter, but if that shelter was a public facility, they should wear a mask and maintain distance. The advice was contradictory. The safest place during a tornado is often a basement or interior room, but the safest place during a pandemic is away from other people. In a mobile home, there is no safe interior room. The only option is a community shelter, which increases exposure to COVID-19. That trade-off was impossible for many residents to navigate. The Conway tornado demonstrated that the guidance was not enough. In the years since, the topic has been studied by academics and emergency managers. The journal Natural Hazards Review published a paper in 2022 that analyzed the Conway tornado response. The authors concluded that the tornado warning system performed technically well, but the social system failed. They recommended that emergency managers pre-identify mobile home parks and develop tailored response plans. They also recommended that public health agencies be integrated into tornado response planning. The paper highlighted the need for personal protective equipment in shelters and for redundant communication methods. These recommendations are sound, but they require funding and political will. Without that, the lessons of Conway remain academic. The Conway tornado also had a subtle effect on the public's understanding of tornado risk. The pandemic dominated the news cycle. National coverage of the tornado was limited. Local news covered it extensively, but the national networks focused on the rising COVID-19 death toll. The tornado was a secondary story. That limited the public's awareness of the dangers of tornadoes during a health emergency. The NWS tried to raise awareness through social media, but the message did not spread far. The Conway tornado faded from memory quickly. By the end of 2020, it was a footnote. But for the people who lived through it, it is not a footnote. It is a scar. The final chapter of the Conway tornado story may not be written yet. The family of the deceased woman filed a wrongful death lawsuit against the manufacturer of her mobile home, arguing that the home was not built to withstand the winds that occurred. The case was settled out of court in 2022 for an undisclosed amount. The settlement did not change the building codes. The mobile home park was not rebuilt. The land is now a storage facility. The site where the tornado reached its peak intensity is now a field of concrete pads where homes once stood. A few families still live nearby in newer homes that were built with stronger construction. Some of those homes have safe rooms installed with the help of a state grant program, but the grant program is small. In 2023, only 8 safe rooms were funded in Horry County. The Conway tornado was an event that told a story about America. It was about a storm that did not care about a pandemic. It was about a woman who died because she lived in a home that could not protect her. It was about a community that tried to help but was hamstrung by a parallel crisis. It was about the limits of technology and the failures of policy. The tornado was an EF3. It lasted 20 minutes, it traveled 14 miles, it killed 1 person, it injured 30, it destroyed hundreds of homes, it caused tens of millions of dollars in damage. It was not the worst tornado of 2010, but it was one of the most instructive. The question is whether the instruction will be answered. The next supercell will form, the next hook echo will appear on radar, the next warning will be issued, the next mobile home will be in the path, the next family will have to decide whether to shelter in place or to risk exposure to a virus. That decision should be easier. For many, it will not be. The Conway tornado showed that the system is only as strong as its weakest link. And the weakest link is not the radar, not the sirens, not the phones. The weakest link is the lack of safe, affordable housing for the most vulnerable people. That is a problem that no weather service can solve. That line is true, but it is not the full story. The full story includes the choices that led to that weakness being accepted. The Conway tornado was not an anomaly. It was one of more than 1,300 tornadoes that struck the United States in 2010. That year, tornadoes killed 76 people in the United States. Conway was responsible for one of those deaths. The others came from storms in Tennessee, Alabama, Mississippi, Arkansas, and elsewhere. Each death had its own set of circumstances. Each death reflected a gap in the system. But the Conway death was unique because it happened during a pandemic. That context forced emergency managers to think about tornado warnings in a new way. It forced the public to weigh risks that were previously separate, and it forced policymakers to confront a truth they had long avoided. The safest shelter does not exist in the places where the most vulnerable live. In the months after the Conway tornado, the National Weather Service issued a formal request to the Centers for Disease Control and Prevention. The request asked for updated guidelines on tornado sheltering during a pandemic. The CDC responded in May 2020 with a new page on its website titled Severe Weather, Tornadoes, and COVID-19. The guidance advised people to identify a safe room ahead of time, to bring cleaning supplies, to wear masks, and to maintain distance if possible. It also acknowledged that in some cases, people might have to choose between the risk of the tornado and the risk of the virus. The guidance did not say which risk should take priority. That decision was left to the individual. For many, it was not a decision at all. They stayed in their mobile homes because they had no other option. The CDC guidance was a page of text. It did not build a single safe room. It did not retrofit a single mobile home. It did not fund a single community shelter. It was a document, and documents do not stop tornadoes. The Conway tornado also prompted a re-examination of the way tornado warnings are communicated during a health emergency. The wireless emergency alert system sent the warning to phones, but many people in the mobile home park did not have working phones. Others had phones that were turned off to conserve battery. Others did not understand the English text of the warning. The warning was transmitted in English only. The mobile home park had a significant number of residents whose first language was Spanish. They did not receive the warning in a language they could understand. The siren system in Horry County was audible in the park, but many residents later reported that they did not recognize the siren sound. They thought it was a test. The siren tests were conducted on the first Wednesday of every month. The tornado struck on a Monday. Some residents said they had never heard the siren during an actual storm. They did not know what it meant. The language barrier was not a new problem. The NWS had been working on Spanish language warnings for years. In 2020, the NWS issued tornado warnings in Spanish for the first time in Texas and Florida. But South Carolina was not part of that pilot program. The Conway tornado made it clear that the program needed to expand. In 2022, the NWS began issuing Spanish-language tornado warnings nationwide. But the system is still not automatic. Local offices must manually translate and issue the warnings. The process takes time. In a tornado warning, seconds matter. The Conway warning was issued 10 minutes before the tornado hit the mobile home park. That was enough time for translation, but the translation was not done. The people who needed the warning most did not get it in their language. That is not a technology problem. That is a policy problem. The Conway tornado also exposed the fragility of the power grid during a dual disaster. The tornado knocked out power to more than 30,000 customers. The utility company, Santee Cooper, had to send crews to restore power, but the pandemic meant that crews had to work in smaller groups to maintain distancing. The restoration took longer than usual. Some homes were without power for more than a week. In a pandemic, power is needed for refrigeration of medicine, for charging phones, for running medical devices. The loss of power compounded the hardship. The utility company did not have a contingency plan for a pandemic-related workforce reduction during a major storm. After Conway, Santee Cooper developed a new emergency response plan that accounts for reduced staffing due to illness. That plan has been used in subsequent hurricanes. It has not been tested in a winter storm or a tornado. The next storm will reveal whether the plan is adequate. The state of South Carolina also looked at its emergency response coordination between public health and emergency management. Before Conway, the two agencies operated largely in silos. The South Carolina Department of Health and Environmental Control had its own incident command structure. The South Carolina Emergency Management Division had its own. During the tornado, the two agencies communicated informally. There was no formal protocol for sharing data about COVID-19 hotspots with the teams that were setting up shelters. The result was that some shelters were opened in areas with high transmission rates. People who came to the shelter for safety from the tornado were exposed to the virus. After the tornado, the state created a joint task force to coordinate public health and emergency management. The task force meets quarterly. It conducted a tabletop exercise in 2022 that simulated a tornado during a pandemic. The exercise identified gaps in communication and logistics. Those gaps have been addressed on paper. Whether they will hold during a real event remains unknown. The Conway tornado also had an impact beyond South Carolina. In 2021, the Federal Emergency Management Agency updated its guidance for mass care during disasters. The updated guidance included a section on infectious diseases. It recommended that shelters pre-stock masks, hand sanitizer, and thermometers. It recommended that shelters have a plan for isolating sick individuals. It recommended that shelters limit the number of people per room. These recommendations are now standard in the emergency management community, but they are recommendations. They are not mandates. Many shelters still operate on a shoestring budget. The funding for shelters comes from local governments, which are often strained. The Conway tornado showed that the system needs more than recommendations. It needs resources. The financial impact of the Conway tornado was significant. The total insured losses were estimated at $40 million. The uninsured losses were higher. Many of the destroyed mobile homes were not insured. The owners lost everything. The state of South Carolina provided some assistance through the Individual Assistance Program, but the program had limited funding. The federal government did not declare a major disaster. That meant no FEMA individual assistance for homeowners. The Small Business Administration offered disaster loans, but many mobile home owners did not own a business and did not qualify. The Red Cross provided emergency food and clothing. Local charities provided furniture and household goods, but the recovery was slow. For many families, it took more than a year to find permanent housing. Some never returned. The woman who died in the Conway tornado was 53 years old. Her name was released by the Horry County coroner. She lived alone. Her family lived in another state. She had moved to Conway for a fresh start. She was unemployed at the time of the tornado. She had been diagnosed with an underlying health condition that made her cautious about COVID-19. She did not want to go to a public shelter because she feared exposure. She stayed in her mobile home. The mobile home was not tied down. It was not built to withstand winds of more than 70 miles per hour. The tornado produced winds of up to 145 miles per hour. The mobile home was lifted from its foundation and rolled. The woman was thrown from the structure. She died from blunt force trauma. The medical examiner listed the cause of death as multiple injuries due to tornado. The manner of death was accident, but the accident was preventable. The family of the woman filed a lawsuit against the manufacturer of the mobile home. The lawsuit alleged that the home was defectively designed and that the manufacturer knew the home could not withstand the winds common in South Carolina. The manufacturer argued that the home met all federal standards at the time of construction. The federal standard for manufactured homes is the HUD code, which requires that homes be built to withstand winds of up to 100 miles per hour in some zones. The home in Conway was not built to that standard. It was built to the standard for Wind Zone 1, which requires resistance to winds of up to 70 miles per hour. The home was installed in a county that is in Wind Zone 2, which requires resistance to winds of up to 100 miles per hour. The manufacturer argued that the installer was responsible for ensuring the home met the local wind zone requirements. The installer argued that the manufacturer did not provide clear instructions. The lawsuit was settled out of court. The terms were confidential, no one admitted fault, the home was not recalled, the standard was not changed. The Conway tornado is a case study in vulnerability. It is a case study in how a system that works well for some people fails for others. The National Weather Service did its job. The forecasters at the Wilmington office saw the supercell, issued the warning, and followed it with updates. The Horry County Emergency Management Office activated the sirens. The wireless emergency alert system sent the notification. These actions saved lives. They likely saved dozens of lives, but they did not save everyone. The people who were not saved were the ones who did not have a safe place to go, the ones who did not have a car, the ones who did not understand the warning, the ones who were afraid of the virus, the ones who were too sick to move, the ones who were alone. The Conway tornado is not a story of failure. It is a story of partial success, and partial success is not enough. The patterns that led to the Conway tornado death are not unique to South Carolina. They exist in every state that has tornadoes and mobile homes. They exist in every state that has a large population of low-income residents. They exist in every state that has a weak building code. The Conway tornado is a microcosm of a larger problem. The problem is that the most vulnerable people are the least prepared for disasters. The problem is that the systems designed to protect people are designed for people who have resources. The problem is that the gap between the rich and the poor is also a gap in disaster resilience. The Conway tornado did not create that gap. It revealed it, and the revelation has not been enough to close the gap. In 2023, the National Institute of Standards and Technology published a report on tornado vulnerability in manufactured homes. The report analyzed data from the past 20 years and concluded that residents of manufactured homes are 15 times more likely to die in a tornado than residents of site-built homes. The report recommended that the HUD code be updated to require all new manufactured homes to be built to withstand winds of at least 100 miles per hour, regardless of the wind zone. The recommendation has not been adopted. The manufactured housing industry has lobbied against it. The industry argues that the cost increase would make housing less affordable. That argument is valid, but the cost of a human life is also valid. The Conway tornado is a reminder that the trade-off is not abstract. It is a trade-off that costs lives. The Conway tornado also highlights the importance of community shelters. After the tornado, Horry County applied for a FEMA grant to build a tornado-safe room in the area that was hit. The grant was approved in 2022. The safe room was completed in 2023. It can hold up to 200 people. It has backup power, ventilation, and space for social distancing. It is located less than 1 mile from the mobile home park. It is open to the public during tornado warnings, but the safe room is not a perfect solution. It requires people to leave their homes and drive to the safe room. Some people do not have cars. Some people have mobility issues. Some people will not leave because they fear COVID-19 or other illnesses. The safe room is a step forward, but it is not a cure. The Conway tornado taught the emergency management community that the old playbook needs revision. The old playbook said, issue the warning, sound the sirens, open the shelters. The new playbook must say, issue the warning in multiple languages, ensure the sirens are audible and understood, open shelters that are safe from the virus, provide transportation to those who need it, and retrofit the homes that are most unsafe. That new playbook is being written, but it is being written slowly. It is being written by people who have not yet experienced a tornado during a pandemic. Those people are trying to imagine what it will be like. The people of Conway do not need to imagine, they lived it. The woman who died in Conway had a name, she had a life, she had a family, she is not a statistic, she is a person. Her story is one of the stories that make up the larger story of the Conway tornado. The larger story is about a storm that hit at the worst possible time. It is about a community that responded as best it could. It is about the systems that worked and the systems that failed. It is about the people who survived and the people who did not. The Conway tornado was an event that lasted 20 minutes, but its consequences will last longer. The safe room will stand for decades. The building code debate will continue. The lessons will be taught in emergency management conferences. The question that remains is whether the lessons will be applied. In March 2024, the South Carolina General Assembly again considered a bill to strengthen mobile home construction standards. The bill was similar to the one introduced in 2022. It required new manufactured homes to be built to withstand winds of at least 100 miles per hour. The bill had the support of the South Carolina Emergency Management Division. It had the support of the South Carolina Department of Insurance. It had the support of the Horry County Council. But the manufactured home industry again argued that the cost increase would harm low-income families. The bill was amended to include a phase-in period of 5 years. It passed the House but stalled in the Senate. As of October 2024, the bill has not become law. The next tornado season is approaching. The Conway tornado is not a forgotten event. It is a reference point. It is an example that emergency managers use to illustrate the dangers of compound disasters. It is a case that academics cite in papers on disaster risk reduction. It is a memory that the people of Conway carry. The tornado changed the landscape, both physical and emotional. The scars are still there. The fields where homes once stood are empty. The new safe room is a concrete structure that stands alone. The people who lived through the tornado go on with their lives. They have birthdays and holidays and ordinary days, but they also have a memory. They know that on the morning of April 13th, 2020, the sky turned green. They know that the wind came. They know that the warning came too late for one person. They know that it could have been worse. They know that it could happen again. The Conway tornado was a warning not just for the people of Horry County, but for the entire country. It showed that the most vulnerable people are the most at risk. It showed that disasters do not respect boundaries. It showed that a pandemic can make a tornado more deadly. It showed that the solution is not just better warnings. It is better housing. It is better preparation. It is better policy. The Conway tornado was a lesson. The question is whether that lesson will be learned. The answer will not come from the sky. It will come from the ground. It will come from the decisions that are made in state houses and county offices. It will come from the funding that is allocated or withheld. It will come from the standards that are raised or left in place. The Conway tornado is over. The story is not. On April 13, 2020 at 10:04 a.m., the Conway tornado lifted east of the city. The National Weather Service survey team arrived the following morning. They documented the damage path 12 miles long up to 400 yards wide. They rated the tornado an EF3 with estimated winds of 140 miles per hour. The survey took 2 days. The report identified 21 destroyed structures, mostly manufactured homes. The report also noted that 8 of the destroyed homes were not anchored to the ground. That meant the wind had simply lifted them off their blocks and thrown them across the street. The lack of anchoring was not a violation of state law. South Carolina did not require mobile homes to be tied down if they were built after 1994. The 1994 HUD standard had become a floor, not a ceiling. The survivors returned to the debris field within hours. They picked through what was left. They found photographs, pieces of clothing, toys. They used wheelbarrows and pickup trucks to haul away splintered wood and twisted metal. The Red Cross set up a shelter at a local church, but attendance was low. The pandemic made people wary of congregating in enclosed spaces, so the Red Cross switched to providing hotel vouchers and food delivery. The Federal Emergency Management Agency opened a disaster recovery center in Conway. It operated with plexiglass barriers and mask requirements. FEMA distributed $2 million in individual assistance to survivors, but not everyone qualified. The family of the woman who died received funeral assistance. Her neighbors, who had lost everything but survived, received up to $34,000 each. That was the maximum under FEMA's individual assistance program. It was not enough to replace a home. It was enough to rent an apartment for a year. The state of South Carolina also activated its disaster recovery program. The program provided grants to low-income homeowners for rebuilding, but the program required that rebuilt homes meet current building codes. For mobile homes, that meant the 2015 HUD standard, which required wind protection of 70 to 100 miles per hour depending on the zone. The zone for Conway was 100 miles per hour. So any new manufactured home placed in the same location had to be built to that standard. The cost difference between a standard home and a wind-rated home was about $5,000. That cost was covered by the grant, but the grant only applied to homes that were owner-occupied. Renters received nothing from the state program. The mobile home park where most of the deaths occurred was a rental community. The owner of the park had some insurance, but not enough to cover all losses. He decided not to rebuild. The land remained vacant, the tenants scattered. The question of why the woman died was not answered by the autopsy. The autopsy confirmed traumatic injuries consistent with a tornado, but the deeper question was why she did not evacuate. Her family said she had no car. She relied on a neighbor for rides. The neighbor had evacuated earlier that morning when the first warning was issued. The woman stayed behind because she thought the storm would pass. She had lived in South Carolina her whole life. She had experienced tornado warnings before. She had never actually seen a tornado. She did not realize that an EF3 on the ground is different from a warning on a phone. The warning that reached her phone was generic. It said, "Take shelter now." It did not say you are in the direct path of a tornado that will arrive in 7 minutes. The wireless emergency alert system does not provide that level of granularity. It broadcasts a blanket message to all phones in the county. The message is the same for everyone, regardless of whether they are 2 miles or 20 miles from the tornado. The woman lived 4 miles from the first reported damage. She had some time, but she did not have transportation. The Horry County Emergency Management Director later acknowledged that the siren system had gaps. The sirens were designed to be heard outdoors. They were not intended to wake people up or penetrate sturdy walls. In the mobile home park, the sirens were audible, but many residents said they did not hear them because they had air conditioners running. It was April in South Carolina. The temperature was mild, but the humidity was high. Windows were closed. The sound of the siren was muffled. The director said the county had considered upgrading to indoor sirens or digital alert systems, but the cost was prohibitive. A county-wide upgrade would cost $2 million. That money had not been allocated. The National Weather Service office in Wilmington also reviewed its performance. The office had issued the first warning at 9:48 a.m., 11 minutes before the tornado touched down. That was within the standard of 13 minutes. The warning was based on radar signatures. The storm had a mesocyclone with strong rotation. The lead forecaster said he had been watching the cell since it crossed the state line. He issued the warning at the first sign of a debris signature. The debris signature is a radar signature that indicates the tornado is already on the ground, lifting debris into the air. The forecaster saw it at 9:48. The tornado touched down at 9:50. That is a 2-minute lead time. The warning went out at 9:48. The sirens were activated at 9:50. The tornado reached the mobile home park at 9:55. The people in that park had 5 minutes from the siren to the impact. 5 minutes is a long time if you have a car and a plan. It is not enough if you are alone, sick, or confused. The Weather Service also faced a communication gap with the local media. The primary television station in Myrtle Beach had a weather alert system that interrupted regular programming, but at 9:48 a.m. the station was airing a national morning show. The interruption caused a crawl bar at the bottom of the screen. The crawl bar said tornado warning for Horry County. It did not include the specific location of the storm or the path. The viewer would have to look at a radar map to determine the risk. Many people did not do that. They assumed the warning was for the county in general, not for their specific neighborhood. The station later added a full-screen graphic with a map overlay, but that did not happen until 9:55. By then, the tornado was already on the ground. The response from the Public Health Department was also slow. The pandemic had stretched the department's resources thin. The director had prioritized COVID-19 testing and contact tracing. Tornado response was not in the plan. The Public Health Department did not have a procedure for evacuating vulnerable populations during a pandemic. No one had written that playbook. The county had a general emergency plan, but it was written in 2007. It did not account for a simultaneous pandemic. The plan assumed that people would gather in shelters. It assumed that transportation would be available. It assumed that volunteers would show up. None of those assumptions held true on April 13th. The American Red Cross also ran into problems. The local chapter had been activated for COVID-19 response in March. Their volunteers were already stretched. Many were elderly themselves and feared exposure. The Red Cross was forced to rely on a smaller pool of younger volunteers. Those volunteers arrived on scene within 2 hours. They set up a mobile response unit with food, water, and hygiene kits, but they could not open a traditional shelter due to health restrictions. Instead, they distributed supplies from a church parking lot. The supplies included masks, hand sanitizer, and information sheets about tornado recovery in 3 languages: English, Spanish, and Haitian Creole. The Haitian Creole translation was new. It had been written after the 2018 Hurricane Florence response, when it became clear that the local Haitian community was underserved. The translation was accurate. But the information sheets did not include instructions on how to apply for FEMA assistance. That information was online, and not everyone had internet access. The Conway tornado was the subject of multiple after-action reports. The Horry County Emergency Management Division published its report in July 2010. The report recommended that the county create a registry of vulnerable residents. The registry would include people with disabilities, the elderly, and those without transportation. The county would maintain a list of these residents and check on them during severe weather warnings. The report also recommended that the county install weather radios in every mobile home park. The radios would be programmed to alert residents even if they were sleeping. The county applied for a grant to fund these radios in 2012. The grant was denied because the program had expired. A new grant cycle began in 2012. The county applied again. That grant was approved in 2013. As of October 2024, the weather radios have been distributed to 5 parks. There are 73 mobile home parks in Horry County. The state of South Carolina also reviewed its mobile home safety regulations. The South Carolina Fire Marshal's Office oversaw the installation of mobile homes. The inspection process was minimal. The Fire Marshal's Office did not require a permit for a mobile home placed on private land. The permit was required only for the tie-down system, but the inspector could only see the tie-down system if the home was not already set in place. In practice, many homes were set by contractors who did not call for inspection. The Fire Marshal's Office had 4 inspectors for the entire state. They could not physically inspect every mobile home, so the system relied on self-certification. Contractors were trusted to install the tie-downs correctly. The Conway tornado revealed that self-certification had failed. The manufactured home that was lifted off its foundation had no tie-downs at all. The contractor had claimed on paper that they were installed. The contractor was never investigated. The federal government also acted. In 2021, the Department of Housing and Urban Development proposed a rule to strengthen wind protection standards for manufactured homes. The rule would require all new manufactured homes to withstand winds of 100 miles per hour, regardless of wind zone. The rule was supported by the National Weather Service, FEMA, and the American Society of Civil Engineers. The manufactured housing industry opposed it. The industry argued that the rule would increase the cost of a home by an average of $3,000. They said that would price out low-income families. The rule was sent to the Office of Management and Budget for review in early 2020. It has not been approved. The industry's lobbying has been effective. The rule remains in limbo. The Conway tornado also prompted a change in the way tornado warnings are issued. The National Weather Service began testing a new product called Tornado Impact Warnings in 2020. These warnings are issued only for EF2 and stronger tornadoes. They include a polygon map that shows the exact path of the storm, along with a description of the expected damage. The warning is automatically sent to wireless emergency alerts, but it also includes a voice message that reads aloud the key points. A tornado has been confirmed on the ground. It is heading east at 50 miles per hour. Seek shelter immediately. The voice message is intended for people who cannot read the text or who have visual impairments. The Conway tornado was one of the events that led to this test. The test is ongoing. The personal stories of the Conway tornado are documented in a public archive at the Horry County Museum. The archive contains interviews, photographs, and 911 call recordings. The recordings include the call from the woman who died. She called 911 at 9:53 a.m. She said she could hear the wind. She said she was scared. The dispatcher told her to get into the bathtub and cover herself with a mattress. She said she could not move. She said she was in a wheelchair. The dispatcher stayed on the line. The recording ends with the sound of breaking glass and a loud roar. The line went dead. The dispatcher later testified that she heard the woman scream. The relationship between the victim and the dispatcher is part of the tragedy. The dispatcher wanted to save her. The system failed her. The Conway tornado is now taught in emergency management courses as a case study in inclusive planning. The courses ask students to design a warning system that works for people who are disabled, poor, and isolated. The students often propose a combination of sirens, weather radios, SMS messages, and community van services. The students also propose that all new manufactured homes be built to wind-resistant standards. The students are graded on the feasibility of their plans. The instructor reminds them that the real world has budget constraints. The instructor also reminds them that the cost of a life is not counted in the budget. In March 2024, the South Carolina Senate held a hearing on the stalled mobile home safety bill. The bill had passed the House for the second time. The Senate committee took testimony from survivors, emergency managers, and industry representatives. The survivors spoke about losing everything. The emergency managers spoke about the gaps in the current system. The industry representative argued that the bill would create a mandate that could not be met by the existing manufacturing capacity. The committee chairman asked whether the industry would support a phased approach. The industry representative said they would. The bill was amended to require compliance by 2030. The amended bill passed the Senate committee. It never reached the full Senate for a vote. The legislative session ended. The bill died again. The Conway tornado remains a reference point for the intersection of natural disasters and social vulnerability. The story is not unique. It is repeated in Joplin, in Moore, in Mayfield. It is repeated wherever poverty and mobile homes overlap with the path of a storm. The difference in Conway was the pandemic. The difference was the fear of the virus. The difference was the lack of safe options. The Conway tornado is not a story of a perfect storm that hit a perfect community. It is a story of an imperfect community that tried to prepare for a perfect storm and fell short. The attempt was honorable. The shortfall was deadly. The long-term memory of the Conway tornado is fading. The grass has grown back over the empty lots. The new safe room stands empty most days. The old building codes remain in place. The bills continue to be introduced and die. The dispatcher still works the emergency line. She says she thinks about the call every day. She says she wishes she could have done more. The family of the woman who died does not live in Horry County anymore. They moved away. They could not bear to see the empty lot where the home used to be. The lot is now a small field of wildflowers. The flowers bloom every spring. The tornado did not destroy everything. The foundation is still there, embedded in the ground. The family does not visit, but they know it is there. The Conway tornado will be remembered by the people who lived through it. It will be remembered by the emergency managers who responded. It will be remembered by the policymakers who tried and failed to change the laws. It will be remembered by the meteorologists who issued the warning. The question is whether it will be remembered by the public. The public has a short memory for disasters. The attention moves to the next storm, the next flood, the next fire. The attention does not stay on the policy gaps. The attention does not stay on the mobile home parks. The attention does not stay on the woman who died alone in a wheelchair. The Conway tornado is over. The story is not. The story will be retold until the gaps are closed. Until then, the story remains a warning.